Hello, my name is Claire Mullen and I work at Health Consumers Council in Western Australia. And I'm going to give you an outline of a project that's a collaboration between the Health Consumers Council, the State Department of Health and the WA Primary Health Alliance to develop and now implement the Healthy Weight Action Plan. As I start, I'd like to take a moment to acknowledge the traditional and ongoing custodians of the land that I am on as I record this. That's the Whadjuk people of the Noongar Nation, and pay my respects to their elders, past, present and into the future. And also extend my respect to all other Aboriginal and Torres Strait Islander cultures across this land that we now call Australia. So a little bit of information about the project. As is common across Australia, overweight and obesity impact about 70% of adults and 25% of children in Western Australia. And so it's clear that a partnership and collaboration between community, government, health services and primary care is essential to address this complex health issue. And so consultation and partnership with consumers and community members started in 2018. And that was critical, it was seen as critical by the project team from the outset to really ground and inform the development and the implementation of the plan. That work right from the outset has involved Health Consumers Council advocating and engaging with consumers and community members, the Health Department advocating and engaging with government and state health services, and the WAFA engaging and advocating for primary care. And each of us has engaged with those networks and brought that information back to develop what is a comprehensive plan to tackle this complex subject. The activity, the Health Consumers Council has received funding from the Health Department and partially from WAFA to fund our engagement activities in this space. And those resources have been used to fund ongoing engagement such as social media, direct mail, events, a consumer and community advisory group, and the production of materials, including some consumer story videos. And that partnership approach started from the outset. So Health Consumers Council was part of the initial governance as the project was scoped and started, advocating for consumers, and now continue to do that as the project is what was being planned and is now being implemented. The engagement processes that we did were quite diverse because of the subject and the diverse experience that people have. We did an online survey with 750 responses to the subject, is weight a weight on your mind? We held consumer focus groups in person, and also we did an online brainstorm using groupmap.com. And we encouraged consumers to share their stories in writing using an anonymous SurveyMonkey format. And also we offered people the opportunity to be recorded on video. We maintain a private Facebook group, and we have a targeted mailing list that we send fortnightly updates to. We have a consumer and community advisory group, both to be able to respond to requests from health services for consumer input, but also to be able to initiate and prompt discussion about priorities from the community's perspective. And Health Consumers Council and consumers and community members have participated in forums with clinicians, researchers and policymakers. For example, the consumer videos were shown at the start of the first summit held in October 2018 to really ground the day and get people coming to it through the lens of consumer focus right from the outset. What consumers have told us through those engagement processes, in the initial survey, 41% of people said they had taken action to lose weight more than 5 times in the last 12 months. Only 15% of people had accessed the GP for support in that process. Only 9% of people had worked with a healthcare team with a healthcare plan, and 9% had used clinical interventions such as surveys. We heard that people want ongoing, affordable services that respond to their needs. And I think one of the strongest pieces of feedback that came across all of the stories and all of the data and all of the input that we've had is really just how diverse everybody's experience and needs are. And so it really is an area, like many, that does absolutely need a person-centered approach to support. We heard strongly that judgment, stigma, shame and embarrassment can be a barrier to getting the right treatment, either because of people's experiences directly of experiencing that from the health professionals they've reached out to, or because of previous experiences and concern that that will be their experience again. We also heard that many health professionals don't have sufficient time to take that truly person-centred approach and take the time to get to know that person and what's important to them. And that many also don't understand the latest evidence on obesity and can be providing out of date advice along the lines of eat less and move more. In summary, these are the areas that the plan covers, and I won't touch on them all. The plan is online. But the second one there on the right, change how we talk about weight, that is one that came through very strongly from consumers. And Helen Mitchell will talk a little bit later about how consumer feedback through the process of consultation made sure that that had a prominent place in the plan. There's also something in there about empowering the community to take action, and that's something we consistently hear when we talk to place-based community groups. People are really interested to know, what can we do in our community to support a community that supports maintaining a healthy life? And that's definitely a work in progress. In terms of how consumer input made a difference, as I said, consumer input was sought right at the start of the process, but also on an ongoing basis, and it continues to be sought and used today. An important part of that was that once the plan had been drafted, that another round of consumer feedback was sought. And that's the point at which, as Helen will describe, that consumer feedback made sure that what might have been seen as less of a priority was actually understood to be a priority from the community's perspective. And so that consumer experience has made sure that the lived experience has been at the centre of the policy development process. I'll pause now to hear from Helen and Kate Ivanovsky from the WA Primary Health Alliance. And so the lessons learned and key takeaways are the value of the strong commitment and partnership from the outset. And I must commend the Health Department and the WA Primary Health Alliance for their commitment in this project. I've worked on a number of projects across a number of stakeholder groups, and this one really does stand out through the commitment to seeking and acting on the feedback that's received. There's also political commitment to new ways of working. So the Sustainable Health Review in Western Australia outlines a political commitment to working across the boundaries of community, government, state and federal boundaries, and so that has been a great thing that has given and continues to give this project momentum and support. I would say from Health Consumers Council's point of view that what has been great is that adequate resourcing has been an important part of this project. It's enabled us to dedicate specific resources to nurturing, reaching out to and presenting consumer voices. So for example, if there's a project that relates to the Health Debate Action Plan, we're able to be proactive and say, we've been supported to seek consumer voices, how can we help? And we can do that in a range of ways. For example, being able to quickly turn around a consumer workshop for one of the projects that wanted to get some consumer input at short notice. But we also know that engaging some groups will take time, and that's something that having some dedicated staff time is enabling us to do. But a key thing I think about working across these partnerships, so both with individual consumers and us as a consumer group across the health department and across WAFA, is acknowledging that we won't get it right all the time. What I've really enjoyed is the opportunity to have a bit of a prototype approach, which is, okay, how did that go? What can we learn? What can we do differently next time? And also acknowledging that we will disagree, and that and planning for that up front, acknowledging that how will we address conflict and difference when it comes up? And so these are just some of the lessons. It's been a very big project, and it continues to be complex and far-reaching, and we don't have long today. So if people have more questions, I know that myself and Helen and Kate would be happy to answer questions at another time if that's helpful. Thanks for the opportunity to present. Here are some links and some contact details in case you want to follow up with any of us. Thanks.